Yes. So go through your letter for a few 1 or 2 minutes. Any spelling miss, anything you have, just to go through that. Right. So Kamalesh. Kamalesh. Yeah. Okay. So 1, 2. Yeah. Right. So this is the case notes. Go through the case notes for a minute. Yeah. Right. So I've given you the case notes. Let them come, little more students. Number. So this is the second page. This is a medical letter. All the doctors go through the points. So I'm going to start a series of letters corrections for doctors. I'm going to place all these letters on the net so that they will be helpful for the others also. So, right. Here, Alison Martin, female, 28 years old. So, this is not an authentic letter. How do we know that this is not an authentic letter? Because of discrepancies. What are the discrepancies? You can see they don't know how to put a comma also. Comma, where comma should be there. Okay. These are the discrepancies. Yeah. So you can see here. Comma. Somebody who has no idea. So like this, lot of discrepancies will be there. Okay. Fine. Okay. So The beginning itself. Fine. Okay. Right. Now coming to the point, let us see according to our system of understanding. Right. Okay. So this is a letter of a doctor from Andhra Pradesh, Vijayawada. The name is the name Kamalesh Inteti. The professor, associate professor in a medical college. Right. Now let us see that. We'll be shifting, shuffling the case notes and the letter sometimes like this. So don't get panic. So first let us start here. This is a referral letter. This is a referral letter. Remember that. This is a referral letter, and the letter is written to Dr. Peter Kasimatis. Dr. Peter Kasimatis. Okay. Dr. Peter Kasimatis, right? And he is a psychiatrist. Psychiatrist. Why these letters are joined? Either write separate letters. Okay, H. Psychiatrist, and I are joined together. T and R are joined together. Be careful. So then next one is 1414 Logon Road. Your handwriting is excellent this slide. Follow the same style. Then Mount Gravatt. 4222. Mount Gravatt 4222. You can write here itself. This one you can write here itself. That's fine. Pin code. Okay. So you can put this here. And next, anything else? Psychiatrist. Okay. And it is a referral letter. That's okay. So the purpose is this one. This is the purpose of the letter. So this, the purpose. This is the purpose of the letter. Be careful. So that is the purpose of the letter. Okay. So you are Dr. Ivan Henjak, and you are the general practitioner. So Dr. Ivan Henjak, general practitioner. Last time you wrote wrong spelling. Okay, yours sincerely. This R, be careful. Okay, fine, that's fine. 2 lines, very good. Excellent. So we are done with that. Then we go. Dr. Kasimatis, dear Dr. Kasimatis. Kasimatis, okay, that's fine. Then 10th February 2020. So 10 February 2020. Possible diagnosis, signs and symptoms suggest schizophrenia and associative associated disorders. Okay. Today's date is 10 February 2010. That is it. If this date is a different one, then it will be tomorrow or day after tomorrow. Be careful. So 10 February 2020 is absolutely right. 10 February 2010, not 20, right, correct. Then next one is Alison Martin, 28-year-old teacher. Okay. It's a 28-year-old teacher. So then we have to write a 28-year-old teacher. This is what I told you. So female, 28 years old, or a 28-year-old teacher. That way how you can write, or this way you can write. You can write like, say, a 28-year-old. You can write like this. Okay, 28-year-old teacher. This like this you can write. Okay, or you can write just 28 years old. Okay, that's it. Separate it from teacher. When you write teacher, then must a should be there. So otherwise separated by commas. 28 years old, plural should come. So that was the confusion here. Okay. So there are some mistakes. I told you discrepancies are there. Okay. Right. Fine. Next. Regarding Alison Martin. Alison, how many L's are there? You think the OET people, they don't know what is the spelling of Alison? Why did you write double L? Why are you writing on your own? You think that there are no mistakes? Dr. Kamalesh? Huh? You think that there are no mistakes? Why a capital letter? Two mistakes in this line. Why? Okay, mistakes are mistakes. Mistakes happen. You have to check and cross-check. Alison Martin, spelling is single L. How dare you write spelling mistake for the name of the patient? You don't know the name of the patient? Huh? That is the name of the patient. And it should be small letter. Aged 20. Mrs. Martin, a teacher. A teacher. Good. Who is a patient of mine. Who is a patient of mine? Your patient, that's why you are writing. Why do you want to write my patient? I told you don't bring yourself into the picture. No? Somebody else's patient, you will not write a letter. No? It's understood it is your patient. Who is a patient of mine? Why do you want to write he is a patient of mine? Okay. Who has been treated since 2000, can write. Who has been treated? Who has been visiting since 2000? Who has been treated since 2000? Was possibly suffering from schizophrenia. So from 2000 till now was suffering from schizophrenia. What do you mean? Or was, not now? Was, not now? What do you mean by was? That means you are clear that only past she was suffering from schizophrenia. What are you writing? Was possibly suffering from schizophrenia. That means not now. Whose signs and symptoms are suggestive of schizophrenia, or whose preliminary diagnosis, who has been preliminarily diagnosed with schizophrenia, or whose signs and symptoms are, whose signs and symptoms are suggestive of schizophrenia, or who has signs and symptoms suggestive of schizophrenia. Right? Requires your evaluation. Why your evaluation? That's why you are writing to him, no, for his evaluation. Just write evaluation. If you want somebody else's evaluation, you will not write to him. No? It's understood, because I am writing to you means it's understood that it's your evaluation and I am writing. My patient is understood. Your evaluation is understood. Why do you want to put mine? Why do you want to bring yourself into the picture? Why do you want to write your evaluation? That's understood. And expertly advise. Expertly advise. Advise, CE, not SC. Change, modify your style. Modify your style, please. Mrs. Martin, whose signs and symptoms are suggestive of schizophrenia, you can write about she has been a patient, but that you can write in the letter. That is not important. It's not. You are not that important to go into the introduction. What is important? Purpose is important. Patient is important. Problem is important. Why are you going into the introduction and why are you bringing the other person? Dr. Kasimat is also into the picture there. It's understood. On the management. Okay. Requires what? Already told here. Purpose is here. Assessment. And further, what assessment? A definitive diagnosis. Because you have done the possible diagnosis. You have done the possible diagnosis. Dr. Kamalesh Inteti. K4E5204. I asked you already to come with your original name. Please. I told you I will not ask again. I'll just remove and put outside the platform. I want everyone to be the name. We come with the name. Because there are sometimes some people coming with the artificial intelligence and spoiling my screen. So that's the reason why I'm asking. Please. I am now changing your name to first and second. It's okay, no problem. No need to get upset or angry with me. First and second names are important, please. Okay? First and second names are important. Next time, if you come with K4E50, I will not permit. Sorry. Then. So this is the purpose of the letter. Because these are the, yes, Dr. Kamalesh Inteti.
Sir.
Are you ready for a serious attack or no?
Yes, sir.
Or do you want a mild evaluation?
No, sir. Serious attack.
Okay, mute back. So now this is, if it is a nurse, I would not have given this serious level of correction because my tone will be different totally. Okay. Nurses are not that much well-read people. You doctors are highly read people. That means you have read hundreds of books. Okay. So that's why I can take you to task. I'm taking you to task. Really, I'm taking you to task now. Okay. Be ready for shots from all the sides. So here, this is a probable diagnosis. Then where is the definitive diagnosis? This is for the definitive diagnosis. The purpose is to ask for a definitive diagnosis and follow-up action plan or further management. Why don't you write that? Mrs. Alison Martin, whose signs and symptoms are suggestive of schizophrenia and associated disorders, requires a definitive diagnosis and appropriate management. That's it. So, Mrs. Alison Martin, that's it. Mrs. Many people write, I am writing to refer. No need all those things. Mrs. Alison Martin. You don't know the spelling. How can you write a wrong spelling of your own patient? Mrs. Alison Martin, comma, whose signs and symptoms, or who has the signs and symptoms. Whichever you want to write, you can write. Mrs. Alison Martin, who signs and symptoms are suggestive of schizophrenia. It's a schizophrenia. Schizophrenia, many people don't know the pronunciation. Schizophrenia and associated disorders. Mrs. Alison Martin, whose signs and symptoms are suggestive of schizophrenia and Mrs. Alison Martin is a teacher. Why do you want to take into the letter in the beginning? Is this that important to go into the... She is a teacher or not, that all don't need. That's not that much important. Patient is important, case is important, purpose is important, present condition is important. Those you take. Her profession, her habits and all these things we don't need. That's not that important. He doesn't need whether she is a teacher or a salesman. That's not that seriously important. What is it doing there in the introduction? Don't do that. In the introduction, focus on the main things which are more important. What is he going to do if he knows that she is a teacher? Nothing. Okay. So Mrs. Alison Martin, whose signs and symptoms are suggestive of schizophrenia, associated disorders, comma, is being referred. This is a referral letter. Where is the word referred in your letter? Do you know that this is a referral letter? I asked your permission. Excuse me for that. I told you I'm taking you to task. Where is the word referral in the letter here? When it is a referral letter, you're supposed to write referral letter. Here it is given, and refer. Here it is given. Twice important, and still you ignored that. Why? What did you do to this? Why did you ignore this word refer? How dare you ignore the word refer? What are you doing there? He's asking you very clearly in bold letters. Write a referral letter and you don't even bother. Huh? How does he know that it's a referral letter? Anybody know? Anyone knows? Sorry. How does anyone knows? No. How does anyone know? So it's very important to use the word referral. Refer. So where is that? It's missing here. It's missing here. The word refer is missing in your entire letter. How do I know what sort of letter this is? And you're a doctor, and out of all the possible things, how can you miss this, Dr. Kamalesh? You have to be very careful. That's what I know you are very careful, but this you missed here. Okay. In the end also you did not write here. So you have to write in the beginning itself. A lot of improvement is there, but the main heart is missing. Heart. Okay. That itself is important. You're writing a referral letter. That means you are sending this patient for the first time to a new person. That means that is an unknown case to him and a known case to you. Many people don't know. They say known case, known case, known case. Known case to him. It's a known case to you. That's why he's a patient of mine. No need to write. It's already understood that it is a known case for you. And it's an unknown case for the other person because you are referring. You're referring. Okay, you can see here. So it shows that it's an unknown case to the other person. The word refer implies the patient is going for the first time to Dr. Kasimatis. Depending on that only your letter will. That means all the relevant information should. He doesn't know anything about this person, so you have to give all the necessary information. If it is a patient's GP, then you don't need to give. This is a referral letter. This is a referral letter. Try to understand. It's a referral letter, means you are sending him for the first time and all the information should be given which is relevant to the patient. Because he doesn't know anything. That is what is a referral letter. Discharged back into your care. Discharged back into your care, back into your care. This is not a referral letter. This is a transfer letter or a discharge letter. Is transferred back into your care or discharged back into your care. Back into your care means it is known case for both of you now. Earlier you don't know, now you know about him. So now you are sending, so it is known for you and for him also. So you don't need to give the background details there. That's what it is. Okay. If you say referral, immediately he will be ready for everything because he doesn't know anything. So he wants to know everything. When you use the word referral, he will be ready to read everything. If he says discharge letter or transfer letter, then he need not, I know everything. What I want to know, that only is there or not, he will see. That's it. That's the difference between known case and unknown case. Referral letter is an unknown case to him, but for you it is known case. Remember that because you are writing this letter. Unknown case for the other person, recipient. So that word is very, very important. So I'm writing the sentence here. Okay. Mrs. Alison Martin, whose signs and symptoms are suggestive of schizophrenia and associated disorders, is being referred for a definitive diagnosis and appropriate management, further management. Okay. That's it. Mrs. Alison Martin, whose signs and symptoms are suggestive of schizophrenia and associated disorders, is being referred for a definitive diagnosis. That's enough. What more you need? Name of the patient is there. What condition, signs and symptoms stage, that is there. What possible option, what is that, schizophrenia, that is there. It is a referral letter and he requires The purpose is definitive diagnosis and appropriate treatment. Everything is there. Or you can say, Mrs. Alison Martin, who has been preliminary, who has been diagnosed with a possible schizophrenia and associated disorders. So you can write like that one also. Preliminary diagnosis. Okay. Probable, possible. Okay. So this is the way you can write any number of types, different types you can write. That's not a problem. Then next. Mrs. Martin, a teacher who is a patient of mine since 2000, was possibly suffering from schizophrenia. This possibly suffering from schizophrenia. Since 2000, she is a patient. Then what is this related here? Okay. What is this? Since 2000 you have been, why you put there? Is that important? That you have been treating this patient for 20 years? Is that important? And that too going into the introduction of the letter. It only says your greatness that you have been treating her for 20 years. And was possibly suffering, not now, was possibly suffering. Then why are you writing now? What is the letter? Your letter is self-defeated. Was possibly suffering. Then why are you writing this letter? Is not, no. Only was possibly suffering. Not now. So there is, its letter is self-defeated here. So there is no need to write this letter at all. And no need to send this patient at all. But because you say was possibly, not now, that is implied. She requires your evaluation, no need of your. She requires what evaluation? Further evaluation or a definitive diagnosis or further examination or further assessment. Something you write. Advice, CE. ADVICE. ADVICE, sorry. Advice. Is there a word called expertly? Expertly advice. Expertly advice. Adverb. Expertly advice. Advice is noun. And expertly, ly is an adverb. Okay, let me see whether that word is there because I have never used this word. It doesn't mean that it is not there. Yeah. So expertly means with great skill, but expertly is an adverb which is used to another adjective. Expertly, you can say adjective you can use, or another verb you can use, or another adverb you can use, but you have used with a noun, that is the wrong here. This usage we know, even I know that one. This usage is normal. He did in an expert fashion, means expertly. So expertly means with great skill. He operated the patient expertly. He expertly operated. So it is coming before a verb, but you are using before a noun. Actually, you have used a verb only there, but the spelling is actually noun you have to use and you used a verb. That's the mistake there. And this is actually a noun supposed to be here and used a verb. Advise is an act of giving advice, is advice. And then that's a verb, and you cannot use expertly with a verb. Right? On the management. Okay, that we have understood, we have given the sentence. On 9 January, why are you leaving this much space? Your N. Why don't you write beautifully? N. like a inverted cup. Okay. On 9 Jan, here why this much space? Single letter space. On 9 January, comma, she first visited complaining lethargy. She first visited. Why do you want to write she? Why do you want to use the word she? She first visited complaining lethargy. On 9 January, during the initial visit, lethargy, low grade temperature, and displeasure to work were reported or were complained. Okay. Why do you want to use a she? Why do you want to use a she? During the initial visit, you can say. During the initial visit. Now, why I'm telling? Because you are using active voice there. You're using active voice. And we know that it is a she only. Who is that she? Mrs. Martin only. When it is already understood, why do you want to say she, Mrs. Martin every now and then? I told you don't use Mrs. Martin. Doesn't mean that you can use pronoun she. That is also not necessary. No? During the initial visit, comma, on 9 January, comma, during the initial visit, comma, and why this space before comma? Immediately you put, no, why this much space? During the initial visit, comma, on 9 January, during the initial visit, comma, on 9 January, comma, during the initial visit, comma, lethargy, comma, low grade is hyphenated. Low grade is hyphenated. Hyphen is there. Like this, hyphen. This is hyphen. So let us go to the case notes. Low grade. Initial visit. Okay. Low grade temperature. Initial visit. Okay, today's date. Okay, this is first visit. Low grade temperature. See, that is another point. Low grade, hyphenated. Hyphen is needed. Okay, in the official letters, this many mistakes will not be there. Low grade. That's it. Cambridge Dictionary clearly says low grade is hyphenated, of a bad quality or low level. Then why did you not put a full stop, comma? Cambridge Dictionary is telling, okay, I am a very ordinary teacher. Somebody is writing a case notes, means they should all see all these things. OET will not give so many mistakes. The authentic letter, these many mistakes will not be there. Low grade, if many people don't know this, they can learn this. They can learn this. Yeah. So here it is. So low grade temperature, unmotivated at work. So lack of enthusiasm to work. Change the words and write. Na? Displeasure to work. Okay, displeasure. Very good. Very good. Fine, that's good. So she first visit. Okay, during the initial visit, lethargy, low grade temperature, and displeasure to work. Have been, sorry, were reported. This is past tense. On 9 January is past tense. Date is mentioned. Today's date is present. Yesterday also is past tense. So 9th January is definitely past tense. So were reported. Try to understand. When a date is different, that means time is based on date. So today is present tense. Yesterday is past tense. So what is today? You know that 10th February. 10th February is today. 9th January is definitely past tense. Even 9th February is past tense. 9th February is also past tense. Then how can 9th January be present perfect? No. So that's its past tense. So simply write like that. So you have used past tense. That's very fine. On 9 January, she first visited complaining lethargy, low grade temperature, and display. This is correct. What your sentence is correct. There is no problem with your sentence. But for your sentence, because there are no mistakes in your sentence, there is no mistake in your sentence. On 9 January, she first visited complaining lethargy, low grade temperature. Only one hyphen is missing. Otherwise, everything is fine. Low grade only hyphenated. So you will not be punished with a C plus. You'll definitely get for this sentence, you'll get B plus. If you make mistakes, maybe you'll get B, because the quality is fine. But active voice is there. Okay. And personal pronouns are there. So if you go on doing the same thing, active voice, personal pronoun, the quality will degrade to from B plus to B. This sentence is wonderful. Right. However, there was no stress and the mood was stable. However, there was no stress. So you can say, and mood was stable. So you can say, however, stable mood and stress-free condition were noticed. There was no stress. Active voice, the mood was stable. Active voice. So that is what I'm telling you. Your sentence is absolutely right. It deserves a B plus. If you make a mistake, it will go to B. Quality is excellent, not B. Better. However, stable mind and stress-free condition have been noticed. Report mentioned. So you can write like that. No? That's fine. Conservative measures like relaxing maneuvers and regular exercises were suggested. Conservative measures like relaxing maneuvers and regular exercises were suggested. Awesome. This is A grade sentence. A grade sentence. You spoiled the introduction actually. I'm very sorry for that. I did not expect that I could not come out from that one actually. That is why instead of giving personal lecture, I asked I'll come on Zoom. This got damaged. So fine. There's nothing that quality here. Okay, anyhow, you can improve, definitely, I know that. 10 days later, In addition to the persisting complaints, anxiety, insomnia, and headache, has started appearing. How can you write has? Only one thing is there: anxiety, insomnia, and headache. Okay. Is it present? Why you brought has here, first of all? And if that is the case, is it has? It should be have. Even then it is a mistake. So it is double mistake now. Instead of have, you wrote has. And there is no question of present tense here. This is past tense. The title on 9th January, that is entirely past tense. The paragraph itself past tense. Today, here you write present tense now. She visited, no, she has visited. Present tense. Why past tense visited? She has visited. So that's the point. This is today. Today means present tense. And this is on 9th January, 1 month before. It's past tense, outright past tense. So why are you using has here? If you don't put has, that was right. Insomnia and headache started appearing. That's enough. Past tense. Okay, be careful with the tense. A possible diagnosis of early depression or schizophrenia or a possible diagnosis was considered. Possible diagnosis of early depression or schizophrenia was considered. This is fine. And diazepam 10 mg during night time or at night. At night. Time is not needed. At time, better. At night. Along with paracetamol as required were prescribed. At night were prescribed along with paracetamol as required. That should come last. This was prescribed along with paracetamol. That should come afterwards. Okay. Along with. So diazepam was prescribed. Diazepam was prescribed along with. How can you say were prescribed? Then you have to say, if you want to say were prescribed, instead of along with, say and. Diazepam and paracetamol as required were prescribed. You're saying along with means along with paracetamol, diazepam was prescribed. That along with paracetamol as required should come to the last. That's why you are confused. Along with. Huh? You can say like this. He was present in the auditorium along with his sisters. Try to understand the sentence. He was present in the auditorium along with his sisters. You cannot say he were present is wrong. He along with his sisters were present. It's wrong. Along with means only you are taking he. So diazepam is one medication taken along with. So diazepam was prescribed along with, in addition to, means you are separating the other one. So and along with the paracetamol as required, diazepam was prescribed. Like that you can write. Actually, paracetamol is a different thing here. Along with this, along with you, I was present. I along with you were present is wrong. Try to understand the point. Along with means separating it. In addition to paracetamol as required, in addition to also the same thing, as well as also the same thing. You cannot use plural there because diazepam is singular. So along with is a bracket here. That means you have to, this along with is in brackets here. You can push it anywhere. This is just an addition. This is just an addition. Now read it out. Along with paracetamol as required, diazepam 10 mg at night was prescribed, or diazepam 10 mg at night was prescribed along with paracetamol as required, or use it as it is. Diazepam 10 mg at night, comma, along with paracetamol as required, comma, was prescribed. That is also right. Along with paracetamol as required is an addition. You can put it wherever you want, in the beginning, in the middle, in the end, anywhere you want to put, you put. But it is separate concept. It should be separated with a comma wherever it is. Considered, and after end only I'm saying, and along with paracetamol as required, comma, diazepam 10 mg at night was prescribed. Number one. Number two, and diazepam 10 mg at night was prescribed along with paracetamol as required. That means this is also prescribed. The meaning is that one. Be careful. Or, and diazepam 10 mg at night, comma, along with paracetamol as required, comma, was prescribed. It is was prescribed. How can you write was prescribed? And diazepam. Diazepam is a brand name or a generic name. Ask Google the pagal. Diazepam. Yeah, diazepam, here it is there. Oral diazepam. It's not a brand name now, it's a generic name because it's not capital letter in the middle of the sentence. This is from Cambridge English Corpus, means awesome. Even higher than Cambridge Dictionary. Because Cambridge Dictionary will borrow the words from Cambridge English Corpus only. Okay, from standard usage. So Cambridge English Corpus is not a joke. So this is not there in the Cambridge Dictionary only. They have to take it from the corpus. So here diazepam is in small letters. See, diazepam is wherever you see diazepam in small letter. Only in the beginning it is in capital letter. That means it's a generic name. Okay. See, diazepam. That's it. I don't need to see anywhere else. Diazepam. This is enough. Cambridge Dictionary ruled out. Even if Cambridge Dictionary is not there, we need not bother about. This is grandfather. This is not our grandfather. This is grandfather of Cambridge Dictionary. Okay. So that's finished. That's clear. Okay. So if there is a brand also, that you have to check. Is there a brand also? That you have to check. Diazepam. Brand name or generic name. Yeah, it is both a generic and a brand name. Yeah. Brand name is value. Diazepam oral tablet is available as both a generic and a brand name drug. Brand name is Valium. Okay. Diazepam is in the beginning. Yeah, diazepam, small letter. Medical dictionary, medical news. Okay, brand name is Valium. Okay. Diazepam, small letter everywhere. So that's generic name. Yeah. So you can see that. Okay, we don't want now anymore. So better to write small letter if you have any doubt. So that's very clear. Along with paracetamol as required were prescribed. Okay, was prescribed, not what prescribed, it was prescribed because diazepam was prescribed along with paracetamol. He has gone along with his sister. So how can you say he have gone along with his sister? He, comma, along with his sister, comma, has gone. It should be has only. Concept is concept. You cannot play the rules with concept. So today, she visited. During today's visit, finished now. Why do you want to write today she visited along with her husband? During today's visit, along with her husband, she is gone. No? During today's visit, along with husband, her husband only. Her husband only, understood. So no need to use. Okay. If it is others, then you have to say, along with mother, brother, sister, or somebody, neighbor. Okay. It's understood, implied. So two words unnecessary, she and her. During today's visit along with the husband, symptoms like altered thought process, visual hallucinations, and delusions for the past 5 days, for the recent 5 days, have been reported. Doctor, doctor, doctor. Don't worry. Don't sharpen a knife against me. I'm your friend only. I'm telling all these things for your own benefit. During today's visit, during today's oh, so during today's visit, comma, during today's visit, comma, during today's visit, along with husband. Whose husband? Her husband only, na? We know that she, who is she? Whose husband we know. So why do we want to tell like a small child? During today's visit along with husband, comma, she reported. That means these things were reported. She reported. We know that it is. Were reported by her only. Symptoms like okay. Symptoms like altered thought process, not altered thought process, only symptoms like altered thought process or symptoms, namely altered thought process. For example, namely, like means what? People like Simon. That means not Simon. Some other people like Simon. Okay. So you're saying like altered thought process. That means not thought process, like. Okay. So you can say symptoms, for instance, namely, such as altered thought process, visual hallucinations. No problem. That's not a mistake. Okay. You can improve. That is what I'm saying. Visual hallucinations. Hallucinations. Okay. And delusions. For the last 5 days, for the previous 5 days, for the recent 5 days, visual hallucinations and delusions for 5 days, for the previous 5 days, have been reported. Not past tense, this is today present tense. How can you write visited in the past? Today she visited. What do you mean by today visited? You said today morning she visited, but today she visited. Today is not finished. Today is present. How can you write past tense? How can you write past tense when you say today? You said today morning. Morning is finished. Now evening. So okay. But how can you say today? Today she has visited. It's incomplete. Today is not completed. It's going on. That's why you are saying today. Today is present. Try to realize that the today is not finished. Morning is finished. So you can say today at 10 o'clock. 10 o'clock means hour. Today at 10 o'clock. 10 o'clock is finished. Now it is 4 o'clock in the evening. Then it's okay that 10 o'clock is finished. 10 o'clock is past now. Now this is 4 p.m. That is 10 a.m. This is 4 p.m. 10 o'clock is past. So you can use she today at 10 o'clock she visited. Okay. But today, how can you put past tense? People don't realize the importance of present tense and past tense. If I correct in the same way with everyone, they will just run away from me. Okay. I know you have the courage to take. That's why I took your permission and I'm correcting you so seriously. People think that today she visited is okay. No, it's not okay. Today she has visited, or today morning she visited. Morning is over. Now it is afternoon and evening. So you can say morning is finished. So what time are you considering? That is important. You are considering today. Means today from night 12 to 12 is today. It's not completed. So how dare you write past tense here? Right, altered thought process, comma, visual hallucinations and delusions for the past. For the past 5 days. For the recent 5 days, for the past 5 days, for the previous 5 days. For the earlier 5 days, earlier, previous, recent, prior, recent. Okay. Have been reported. Have been informed. Already we wrote reported, so have been informed. Notified. Reported, notified, informed. Mentioned. Write out the words. Notified, reported, informed, mentioned. Write passive voice. In spite of minimal eye contact. Why you want to use 3 words in spite of? Write despite, no? Despite is a better word. You're saving 2 words. What's the difference between in spite of, despite? Why Simon sir is telling? I don't know Simon sir why he's telling. He's crazy. Okay, in spite of. In spite of is an idiom. Okay, in spite of is an idiom. It's good only, no doubt it's good. But despite, I'm not talking about in spite of, I'm talking only about in spite of. Okay, just in spite of. Okay. So, phrase prepositions. We are using one word, compound prepositions, despite. Despite is a preposition. In spite of is a compound preposition. Now, use one word, no, two words you are saving, nah? Why do you want to use in spite of instead of despite? Despite, finished. Save two words, nah? No, wrong, no, it's not a mistake. It's not a mistake. Yeah, they are same, one and the same. In spite of, despite, although, though, however, even though, whereas, but, yet, all are same. All are same. In spite of and despite, in spite of his phrase preposition and despite his compound preposition. They are used to write simple sentences. Although, though, even though are used to write complex sentences. But and yet are used to write compound sentences, complex sentences. Although, though, even though, complex sentences, but and yet compound sentences. Okay. However, also you can write separating connectors. That also same. However, whereas, same. So, in spite of minimal eye contact, examination was performed. Which revealed? Examination which was performed revealed. Examination was performed which don't really sync together, they don't gel with each other. Performed which? What do you mean by performed which? Examination, comma, which was performed revealed. Examination which, not performed which. Why are you trying to sync which don't sync together? Examination noun, relative pronoun is which. Bring them together, na? This which is not suitable here. This which is related to examination. So write the which here. Examination, comma should come here. One more comma here, one comma here. So comma, examination, comma, which was performed, comma, revealed incomprehensive. This is N or U. This is N or U. Incomprehensive speech. Bizarre. Oh, bizarre spelling. What is the spelling of bizarre, Mr. Simon? Simon doesn't know spelling of bizarre. So let him go to Cambridge Dictionary. Cambridge Dictionary is the father of students. Bizarre. B-I-Z-Z-A-R-E. Is that right? Oh, sorry. Is that right? Okay. Bizarre is a common misspelling of a bizarre. This is the spelling. Okay. Single Z, double R. Single Z, double R. How come you write this spelling, Dr. Kamalesh Inteti? Your bad luck. Sir, give me correction. You told her your bad luck. What to do? Okay, bizarre. How dare you write spelling mistakes when it is already there in the case notes, I think. I hope this case notes who has written did not write the spelling mistake. Okay, then you are safe. Whatever it is, even if that fellow writes spelling mistake, it is your responsibility to write it correctly. You cannot say, yeah, here it is right. Of course, that fellow who has written this case notes has written it rightly. Bizarre. Mr. Kamalesh, Inteti, what are you doing with your eyes? Why have you blindfolded your eyes to this particular word? Why could you not see this word in the case notes? Are you sure that you know the spelling? Have you learned the spelling before? No. Just blindly you are taking some spelling. That's the point. First, when you are writing something in so important a letter, so important an exam, how dare you not check and cross-check? Are you 100% sure that you know the spelling? You did not get even the slightest of doubt? Why don't you question yourself whether you know the spellings or not? If you are not sure, check. Okay. The case notes is there in the case notes. But still you made a mistake means it's not a mistake, it's a blunder. The word is dancing in front of you. The word is dancing in front of you. Huh? What, Dr. Kamalesh, if you write this word in your exam, in your classroom, and your students or doctors, huh? They point out, your lecturer, right? If they point out that, sir, you have written spelling mistake. Huh? That's it. Check and cross check. It's okay. I'm only helping you. This is constructive criticism. This is constructive criticism. This is constructive criticism. 1 second, please. Okay. So, now that is the point. Spelling mistake, you have to be very careful. Yeah. Yes. 1 second. Sorry. My pen. Yeah. So, bizarre behavior and a depressed mood. Do you write it? Is it mood or is it wood? What are you writing, Dr. Kamalesh? Do you think that this is understood as mood or wood? Huh? Kamalesh, 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 Kamalesh. Okay, fine. So what is this you are writing? Is this mood or wood? Now, what should I think about this word, particular word? Huh? You can write anything you want. Anything you want. English, this is English. Dance your English. Dance your English here. That's it. You can write anything there. Dance your English. So, depressed mood. It looks like wood. It's a spelling mistake. Write like this 3 or 4 words and you lose 10 marks. Somebody came with some numbers and digits. Name, please. So write down your name, please. Okay. Be careful with this. Incomprehensive. N and S together look like W again. Huh? Either write cursive writing or write separate writings. Okay. Change every word and write, no problem. She nurtures 2 children and there were no addictions. She nurtures 2 children and there were no addictions. But never start a capital letter. Okay, then you remove this full stop and put small letter. There's a family history of schizophrenia. Why but? That is totally different and this is totally different. How can you write but here? Okay. There is a family history of schizophrenia, which is kept under check by risperidone, which is effectively managed. Schizophrenia, which has been effectively, which is kept under check by risperidone. Okay, which has been effectively managed by risperidone. Better, na? Which has been effectively controlled or managed or controlled by, okay, raining heavily. Risperidone, okay. There were no addictions. What do you mean by there were no addictions? Structures 2 children, there were no addictions. Has 2 children. Addictions nil. There are no addictions means why should you write first of all? If there are some things, smoking, if she smokes, you have to write. If she drinks alcohol, then you have to write. Okay. And drugs, no. Nothing is there. Then why you want to write this no addictions? Then if there are some addictions, you write. Otherwise, why? Okay. If there are some problems, you'll go to the doctor and say, I don't have any headache, I don't have any pain, I don't have any pain. No need to say. If you have pain, you'll say, I have stomach pain, I have chest pain, I have back pain, something like that you can write. Throat pain, okay, knee pain, joint pain, whatever you have, you can write. But if you don't have any pain, why should you tell? Why should you tell that? Okay, that's the point. So, she warrants expertly care. She warrants expertly care. What is this expertly care? You have a habit of expertly. Okay, repeated and thorough. assessment. She warrants expertly care and thorough. So here this is not what it is. Further assessment. She warrants. Why she? No need. No need. She warrants. Based on the above mentioned circumstances. Based on the aforementioned circumstances, comma, based on the aforementioned circumstances, comma, further examination okay, and appropriate, like that one. Okay, further assessment and appropriate care or appropriate management, further assessment, further examination, further evaluation, you can say, further evaluation and appropriate management, appropriate management would be profoundly beneficial. Management would be profoundly beneficial. Full stop. That's it. In case, comma, any additional information is required, comma, do not hesitate to contact me. Fine. Yours sincerely, Dr. Ivan Enjak, General Practitioner. That's fine. Yes, Dr. Kamalesh. Unmute, please.
Sir.
Now you can open your video. Yeah. So you can open your video. Yes. And I'll be very happy if you can share. Yes, very good. Yeah. 1 second. 1 second. So sorry for attacking you like a blind attack, but it was required. So hide video panel. Yeah. So share your experience, Dr. Kamalesh Inteti. Yeah.
Yes, sir. Noticing mistakes and learning from them is a good thing to be official, sir, definitely. For the past 2 months, I've been working on this, and I think I've improved, but still there are things to be changed, and care should be taken while writing.
Okay.
Your corrections were profoundly helpful for me. It's me, I work still more, practice more. Thank you, sir.
Fine. That's good. Thank you very much. You can stop your video and you can stop your audio also. Right. That's very nice. Thank you very much. And here we are going to start the letter correction for doctors. And the doctors' letters correction for nurses, it is 5,000 per month. And for doctors, it is 10,000 per month. Okay, because doctors do more mistakes and doctors need more corrections like this. Okay, nurses, they say, we just want to pass, sir. Okay. So we don't need too much corrections. So they don't demand, they don't warrant too many corrections. So they just want that one. So that's okay, right? But still, doctors, yeah, I charge double. So for nurses, if you are interested, you can contact me. There are 3 places now for writing correction. And you can, and if it is a doctor, I need only 1 doctor now, because already I have 2 more doctors, only 1 doctor. Okay, nurses, 4 nurses are already there. So I need 3 more nurses who want to join. So this batch joined already. The students who have joined are there here. Sija, then Today another girl also joined today. So 4 were there, 3 are remaining. Okay. So if any doctor is interested, you can contact me. So only if you are serious, join me. Otherwise, please stay safe. Okay, this will burn like fire. So if you are really serious to implement all the suggestions, see, this is Dr. Kamalesh Inteti, a professor at Medical College, Vijayawada. Is ready to take all the suggestions. In fact, he told, yes, sir, I'm ready. Then only I gave this feedback. So if anybody is there like that, so you can join us and contact me on my WhatsApp, and you can call me. No, don't call me, contact me on my WhatsApp. So whenever I'm available, I can just get in touch, because mostly I'll be online. So I cannot attend the calls. I don't attend also. So please follow these suggestions, listen to these things carefully, check the spellings. Okay, think about the punctuation, capital letters or small letters, and think about the pronouns, whether we have to write or not write. Okay, pronouns, this she, okay, see here, her, this required. Okay, and hyphenated words or separate words. Pronouns, see, too many pronouns. Sorry, too many pronouns. A patient of mine, don't use the word patient in your letter. Don't tell also. People get angry, offended. Bring the patient here. People get angry. Why are you calling patient? He has a name. Tell, otherwise, if you don't know the name, tell. Bring your father. Don't say patient. How dare you call my father a patient? They'll say. In that case, if in that place, in the patient's father or brother or sister's place, you are there, you'll slap that fellow itself. So don't call somebody as patient. So that's very clear. Right. So that's the point. And be careful of spelling mistakes. Okay, that's all for now. Have a nice day. Thank you very much for watching.